Good afternoon, everyone, and a very warm welcome to the Research webinar for today. It is a pleasure to have so many of you join us today for this very relevant topic, building research capacity in regional health services. My name is Heather Cameron, and I'm the Program Manager for the Revitalise Project's Regional Research Teaching Hub, and we, of course, host the @Research website. So, on behalf of the Regional Research Teaching Hub and all of us present today, I would like to begin by acknowledging the traditional owners of country throughout Australia. I recognise their continuing connections to lands, waters, and communities, and I pay our respects to Aboriginal and Torres Strait Islander cultures and to elders, past and present. And an especially warm welcome to any Aboriginal or Torres Strait Islander people who are joining us today or viewing the recorded webinar. So just some housekeeping before we start. There will be an opportunity to ask questions to our two presenters, so please use the Q&A button at the bottom of your screen. There will be an evaluation circulated post-webinar, and I'd encourage you to provide feedback to the presenters, but also to our team to help us with future planning. And of course, there'll be access provided to the recording of this webinar via the @Research website. So, building research capacity in regional health services. This is such an important topic, and not just for regional health services. How do you embed and grow a research culture in a regional health service when clinical service delivery is frankly hectic and resources may be limited? Today, we're hearing from the experiences of Dr. Leah Damon, who's Manager of Research at South West Healthcare in Warrnambool, Victoria, and from Dr. Denise Jones, who's the Allied Health Researcher and Knowledge Translation Lead. Now, these two health professionals have amazing CVs, and I'm not sure that I'm going to do them credit with this very brief introduction, but I'll try. Denise holds the position of Allied Health Research and Knowledge Translation Lead at Barwon Health and South West Healthcare. She's an adjunct research fellow in the School of Allied Health at La Trobe University, with research focusing on hip-related pain and physical activity. She has considerable clinical experience as a musculoskeletal physiotherapist and as an undergraduate and postgraduate educator in both clinical and university settings. Leah is the manager of the research department at South West Healthcare, encompassing the research, governance, and clinical trials teams. Leah comes from a research and management background in the heritage and archaeology sectors, and prior to returning to Australia in 2020, was studying and then working in the UK for 10 years. Leah, Denise, and the research team at South West Health are working towards the goals of embedding research and clinical trials within the organisation's culture, establishing comprehensive policies and procedures for research at South West Health, and building South West Health's capacity and expertise in this space to contribute to a more complete and accessible healthcare service for the Southwest regional community of Victoria. So I'm looking forward to hearing how they do it and hearing how it's going. Very warm welcome to both Leah and Denise, and I'm now going to hand over to Leah to begin our presentation today.
Okay, hello everybody. Just checking that you can all hear and see me as I start to share my screen for my presentation. Can everybody see that? All right, so as Heather very kindly introduced, my name's Leah Damon. I'm the Manager of Research at South West Healthcare, and I'm based at the Warrnambool site, Warrnambool Base Hospital. Today I'm going to be talking to you about building research capacity in health services, and my part one, is going to be focused very much on the organizational facilitation of doing this in a regional and for rural health services. So I'm just going to quickly start with an introduction, which I'm sure we're all on the same page of this, as why research is important in health services, just both regionally and as a whole. We know that it improves patient outcomes and provider experiences. There's lots of documentation of this. It helps to identify gaps, informs policy change and updates, and it also enhances our service delivery to our communities. It's essential for evidence-based decision-making, especially in regional and remote settings, but also to use as evidence when we need to have our regional voices heard in a more metro, state, national setting, which I think is a really important factor of why having research in regional spaces is important. So some of the challenges I think that we could probably all identify, or those of us who work in regional spaces, but I think even regardless of where you are, is limited access to funding and research infrastructure, workforce constraints, and this can be just even having organizations having an understanding of the importance of time and training for research endeavors alongside clinical priorities. Geographical barriers. This is something that can be mitigated quite a bit by the wonders of the internet, but there is just that difference in understanding of a metro site to a regional site, to a Victorian site, to a Western Australian site, and I think is still a factor. And then obviously there's the ethical and logistical issues in participant recruitment. So this is something we're really aware of in our region in the Southwest, and I'll come back to it a few times in this presentation. Just that awareness that we have a very much smaller catchment area for people participating in research projects for their data, participant data, same for clinical trials, and it's very important to protect their privacy and their data. So for us, it's not necessarily so much about de-identifying the data, it's about the risks of it being re-identified. And I think that's something that really impacts regional communities. So just before I go a bit further into the presentation, I wanted to just do a quick snapshot of the South West Healthcare Research Department and our origin story, if you like. Prior to November 2022, the research department didn't exist in its own entity. It was part of the education department, and it didn't really have dedicated staff or its own strategies and plans within the organization. In November 2022, they decided to separate it out as its own department because they recognized the need for research across the organization, but to have its own entity, and they hired a manager of research, which is me. So that creation of the research department, who reports to the Executive Director of Medical Services, and happened just before 2023, in the summer 2022 to 2023. And it was my remit and our team's remit to establish the need for clearer processes and reporting, inclusion in the organizational structure, which hasn't previously been established, but also just raising the profile and understanding across the Southwest healthcare community that research is a core value. So we identified at the start of this, I guess you'll call it a project, of establishing the department, 3 key areas that we feel are very important to funnel our energy in to do that. And that is capacity and capability building, awareness and education, and policy and processes. And these kind of 3 key areas are important to us to develop and establish the department, but also these are the key areas that we need to sustain, grow, and maintain throughout the life of the organisation. So when I started, it was just a small clinical trials unit who only did oncology trials with 2.5 FTE, a 0.5 FTE research governance officer, and myself. And so now, 2-ish years later, this is our org chart for the department, which I'm very proud of and shows just the commitment and the hard work we've put into building the department as a useful and contributing area of the organisation that people can come to facilitate their research. So we have the unit for clinical trials, we have our ethics and governance team, we have a Western Alliance research translation coordinator who we share with WDHS, and we have an allied health research and translation lead, which is Denise, who you guys will be hearing from. And then I've also indicated the 2 organizational committees that oversee research. So one is obviously the HREC, the Human Research Ethics Committee, which was established before I started, has been going for about 10 years now. And then we established in 2023 the Research Management and Governance Committee, which reports to the clinical governance, which reports to the board. So we have that organizational oversight and presence for research across the organizational structure. So that's kind of a quick snapshot of where we started and where we are now. So going back to the theme of the presentation, our key areas, which were education and awareness, policy and process, capacity and capability building. That's what I'm going to kind of focus the presentation around. So education and awareness, I think we all understand the importance of that. One of the things we really realized at South West Healthcare is that our research capability and culture is very much that of an emerging research centre. It's not established. We're still doing a lot of the foundation and groundwork to build up both the resourcing and the facilities, but also our staff's research capabilities and expertise. So we're very focused on training programs, which include things like AC Tech and VCCC and those sorts of modules. But this year specifically, we are building some internal South West Healthcare specific education models, one for managers who would be supervising staff who want to do research, and then one for researchers themselves as an introductory jumping off point. Promoting research literacy among clinicians and managers. This has become very pivotal to what we do. There's been a lot of awareness building that we've done over the last 2 years of just being like, hey, we're here, we have these resources, we can help you with this advice, whether it's with your application or your protocol, we can connect you with mentors. But now we're really wanting our staff to be able to do those initial steps within their own team before they have to come to the research department. We really want to build that culture, that organizational culture throughout all the departments. And so research literacy among clinicians, nurses, visiting fellows, students, non-clinical staff is something that we're really focused on now that we've established that original ground base of awareness. Then obviously we're really keen to keep building and providing mentorship and collaboration opportunities. So I mentioned before with South West Healthcare, we have ties to Western Alliance, and allied health is obviously very present, and I think a very important presence in regional spaces. But we've also done a lot of work with connecting with our regional neighbours and building those connections and collaborations. One area that South West Healthcare specifically still is in the very early stages of is building our relationships with universities. Obviously, Deakin is right on our doorstep, so that's going to be our first port of call. And then also other organisations like the RTN, Regional Trial Network, for those who, sorry, I just jumped to acronyms, I'm sure we all do it, as well as some of the more overarching state and national providers. And then we really just want to encourage research to take place. So one of the other things we've done at South West Healthcare is to establish a framework, a researcher competency framework, which we can just share very easily. It's a one-pager, gives them a snapshot. They want to do a project. This is the kind of scope, the time frame, and the training that they will have had to undertake that work. That way we're managing people's expectations, but also facilitating projects that are likely to succeed. And obviously one of our long-term goals is to go from an emerging research space to an established research space where there's a really clear culture of research, but also experience in research. So how do we go about facilitating this research culture? One of the key things that we've really had to focus and lean in on at South West Healthcare is the leadership connection. So our connection of the importance, but also understanding of what research is, what entails undertaking research, and the different kind of measurements and KPIs you have for research to maybe other KPIs within a healthcare service to our executive and our board. And we actually had, in some ways, it was a lot of work, but also really useful is the National Clinical Trials Governance Framework. We had our SNAP accreditation at the start of last year. And we really leveraged that to kind of highlight how necessary this was and to get our foot in the door, so to speak, with those parts of the organization to instigate some organizational change. So rather than research being in its own siloed bubble of us just in the ethics and governance office and the clinical trials unit and the research office, just kind of doing our own little thing, kind of separate from the rest of the organization, this gave us the kind of push, I guess, to be able to say, actually, there needs to be organization-wide involvement and understanding of the place of research in South West Healthcare. And it really helped us tighten up some of our policies and processes, which I'll talk about in a minute, but also get that organizational presence, especially at higher levels with oversight, which one of our crowning glory on that is the establishment of the Research Management and Governance Committee, which meets monthly and deals with all governance issues, rather than them either going straight to the CEO or going to the HREC, which they don't really belong in. That's purely for, ethics review. Another thing we've really been proud of is that we've established a annual research day. Which we've had 2 now, which is very exciting. The first one was internal only, and it was really focused on just celebrating and recognizing, but also raising that profile of research and how accessible we want it to be, while also recognizing that it's quite a serious undertaking to do research. But the second year, which was last year, we actually opened it up to external participation as well, which was a big step. And it was really wonderful to not only build those connections with other healthcare providers in the region, but also see what people are working on. And also for my office especially, and for the ethics team, I think as well, it was great to see what happens with these projects once they've been approved and they've come through us and they're off doing the exciting work. So that recognition and celebration of research, I think, is really important. Another thing that we've instigated is that I do a presentation to the executive and the board every 6 months. And part of that presentation is that recognition of exciting projects, milestones, contributions, as well as kind of, I always include a bit of a call to action on the things that we're still working on. So I think that up and also out connection of the staff is really important to see research succeed. So policy and process development. And I think when we started, and possibly even now, even though we've put a huge amount of work at South West Healthcare into developing our policies and processes, it does feel a bit like a conspiratorial mind map with red tape. Establishing clear research governance structures was something we had to address really early on, partly because some of those things there were clear gaps at South West Healthcare in 2022, 2023, but also because with the National Clinical Trials Governance Framework, there were some very clear guidelines on what these things needed to be and include, which was actually really useful for us in that early stage of our journey, because it meant that we established these really strong foundations to be able to support research and establish it within the organizational structure. Streamlining ethics, approval, and project management processes. I'm sure anybody here who's had anything to do with research knows that this is often a very time-consuming and multi-step part of the process of actually getting a research project up and going, whether it's a trial or purely research project. And we've done everything we can at South West Healthcare, and there's still a few things we're tweaking to make that process as navigable as possible and also streamlined as possible. It is still a time-consuming process, and it is something that is very important when we're dealing with human health data on the regular. So it's something that we've been putting a lot of work into. And part of that is ensuring compliance with the national research guidelines, which we take at South West Healthcare as very strong guidelines, if not rules, even though things like the national statement and the National Clinical Trials Governance Framework are guidelines and standards. We tend to apply them as strictly rules as possible. And then part of that is that we have developed South West Healthcare's first ever research strategy. It's a bridging strategy because South West Healthcare is between overall strategic plans at the moment. They're in the process of doing the new ones. This is just to bridge us over to the new organisation-wide strategy, but it gives a very clear indicator. This is it here. I know it's a lot to take in, but you just get an idea. It's a very clear bridge, and it shows our key areas of focus, but also for the rest of the organisation, other departments, and it will tie into the overall organisation-wide strategy, which is a really strong point to be able to use when presenting to people outside of our space so they can see how it all ties in, but also for other organisations to understand our goals as well. So that's been a really key achievement for our team at South West Healthcare. And you can also, if you are interested, see this on our website. You don't have to try and read it all now. So one of the big things I think we could probably all identify as a key component for research success at South West Health, not just at South West Healthcare, but overall, is resourcing. Resourcing is, I guess, that buzzword that's always around and you can always use more of. For us originally, and even now, it's still very much to do with facilitation roles. So building the people, the experts at our organisation who can support those undertaking research. And I think that will shift as research becomes more established within the culture. At the moment, there's a lot of guidance and support required for our emerging research staff, but it's also about funding. I'm just keeping an eye on the time, so I'm not going to go into this too much detail. We can talk about it more if people have questions later. And then also I think partnerships are very important. In terms of investing in digital infrastructure and data collection analysis, this is something that's very much on our radar at the moment. We did set up a digital repository at South West Healthcare in 2023, which is exciting, but this I think is now shifting much more towards data protection in our eyes. And I can save that for anybody who wants to follow up with at the end. Co-design and community impact. I think regional spaces, regional healthcare spaces and providers have a really excellent opportunity and potential to really jump on co-design and including the community in our research goals, in our strategy, and how we design things for impact. We are very aware of our community. We're very closely tied to them. We have a lot of access to them, but we're also very familiar with their needs. And I think aligning our needs to these service gaps and how to address them is really the way that research can be really significantly utilized. Obviously, encouraging translational research for practical impact is a big part of that. And I won't go into that too much because I'm sure Denise is going to talk to that side of things from a researcher perspective. And then also we're trying to focus more and more on including and engaging our local consumers in our co-design of our policy. We have positions on our committees for consumers. Both the HREC obviously has community members and the RMGC has a community member on it. And then we also do a lot of community engagement for feedback. When we bring in new practices, we do a lot of surveys, especially in the clinical trials unit. And then obviously measuring and reporting research impact is very important. There wasn't any clearly captured research reporting before the end of 2022. So that's something our teams worked quite hard on, partly because it's excellent evidence when you are doing a call to action or you're applying for funding or you're talking about the resourcing you need, but also just to show and celebrate our wins, which I think is, we get very easily caught up in all the things that still need to be done. And it's really good to have those kind of reference points of look at how much we've already achieved. And then capacity and capability, which has kind of been a theme throughout, I think. So having that centralized support for research facilitation. So the establishment of the research office and the clinical trials unit, just making the organization aware of about where our resources online, whether it's on prompt or on the intranet or even on the website, so that people can themselves and be informed. Grant applications and funding opportunities is something that I'm very keen to build on from 2025 outwards. We've done a lot of work on our internal structures and now we're starting to look more externally. And then obviously connecting clinicians with academic researchers, which I think is a really key part. Clinicians have a lot of the clinical knowledge and academic researchers will have the understanding of how to get things published, how to write for grants and publication. Statistics, all of those sorts of things, and the collaboration. They need the data, we have the data, let's work together. And so looking forward, just reiterating the kind of key themes of culture, embedding the culture, education and awareness, resourcing, which is capacity building, in my opinion, policy and strategy, the importance of strengthening collaborations and increasing funding opportunities, especially as I'm sure everybody in Victoria is feeling the budget that came out last year. Looking for these funding opportunities is going to be really pivotal to continuing research, but also enabling that culture to grow in regional spaces. And then I think I just want to reiterate that there's a really amazing potential for research in regional spaces. I think nationally, federally, internationally, and statewide, there's more and more of a focus on collating and utilizing research data from regional spaces. And I think we should be the ones who are piloting that rather than handing that over to larger, more removed organizations. And I'm just being very aware of the time. I'm just going to rush through that. I'm happy to circle back to anything or expand on any of these points at the end. So I'll just say thank you so much.
Thank you very much, Leah. Goodness me, the richness and the things that you've been talking about make me think that we should have given you much longer, but wonderful.
I can talk at length ad nauseum. So feel free, anybody who wants to hear that, let me know.
Thank you. Now, rather than go to questions now, I think I will ask Denise to join the webinar and to make a presentation, and then we will have Q&A at the end. So I'll hand over to you, Denise. Thank you.
Thank you very much. So I am now going to attempt to share my screen. Okay, so hopefully that's up and running and somebody will run in from the background and tell me if it isn't. So thank you for inviting Leah and I to speak today, and thank you for everybody for turning up on your lunch break. As you heard earlier, my role in building capacity in regional health services is as allied health research and knowledge lead across both Barwon and South West Healthcare. So I'll be drawing a little bit on my experience from both. My role is focused on allied health, but a lot of multidisciplinary working sits within that. And an approach to research centered around care rather than sitting in disciplinary silos, in my humble opinion, is vital to what we can achieve regionally. So my half of the presentation is more from the perspective of health service staff, who I think are the linchpin of growing our regional capacity building strategies. And also scattered through this, you'll see a few quotes from our clinicians who are at the coalface, who can generally put across much better than I can the points that I'm trying to make. So I think one thing that doesn't come across so much in the literature at the moment, and in some of those slightly doom and gloom post-COVID conversations that we have, is that clinicians really are interested in building their own research capacity and in opportunities to participate. So this figure of 77% is from a survey that we did in 2022 when we were seeking to get a snapshot of research interest across Barwon and South West Healthcare. That groundswell of interest can be supported by embedding research as part of core business. And for some services, that's a real cultural shift. So I think this quote from one of our clinicians demonstrates that often held view that research is somebody else's job. And I think for all services, recognizing the potential scope of what engaging with research means is a way of greasing the wheels towards that cultural change. There are a lot of steps involved, from being a research literate evidence consumer to being a research generator. And there's plenty of potential to build individual research skills and therefore service research capacity along the way. So sorry, this is quite a busy slide and entirely stolen from elsewhere, but I have got a reference there. So given that time, competing clinical pressures is the barrier to research engagement most frequently cited by clinicians, what we need to do is really embrace those interfaces between quality improvement activities, evidence-based practice, and research in inverted commas, and really cash in on those opportunities to build skills and resilience and research resilience offered by those opportunities that sit right across the spectrum. So quality improvement and evidence-based practice are far better integrated and accepted within core business at the moment. And placing these in robust frameworks and communicating with teams across those boundaries offers excellent opportunities for skill building with a focus, which I think is something that's really important to clinicians, because as clinicians, we kind of live to integrate learning into practice. And all these things really hinge on that. If you have a clinical question, you've potentially got a research topic. So where do we start with it? How do we work? So utilizing that full continuum of research activity feeds into a building blocks approach, supporting the doable and setting up for success. Now, Leah talked about our South West Healthcare Researcher Competency Framework, which we're more than happy to share. But using that as a place to start to guide that decision-making process, because what constitutes doable? That's a question that sits with both the individual and the health service. So a few of the things to consider, or those sort of commonly occurring conversations, are around external constraints. If you're in a rotation pattern, that means you're only going to be in a service for a short duration. The choice of project should really reflect that. So we will be guiding people towards case studies and reviews. Complexity and starting skill set probably sit together. So if you're new to research or any particular aspect of research, you'll be learning on the job. And learning on the job often takes longer than you think it's going to, often way longer than you think it's going to. And so in terms of endorsing a project, leaders need to be in a position to appropriately guide clinicians to make informed choices. It's a bit of a no-brainer that things need to align with an area of need for a department, for an organization, and align with strategic plans. There's no point wasting energies going out on a limb for something that nobody within your service is interested in tackling at that point in time, or doesn't sit with your consumer need. I think it's important, and what we're trying to work on is being strategic and considering a body of work. So small projects can lead to other small projects, or they can lead into larger projects, and that works on all levels. So it may be a small scale, single semester student project. How does that then potentially feed into the honours programme. And if there's something really big that a department wants to achieve, how can it be deconstructed? How can it be attacked progressively? So the old question of how do you eat an elephant? And if you're looking at grant funding, how can you use smaller scale projects to demonstrate your suitability for that grant? Part of that strategic planning process is to start to act to integrate meaningful student research. And this again is something that we're just beginning to build on. And it sits within that building block model. So often the first step in trying to answer a question that a team are interested in but haven't got the time and the resources to put to it can be helped by having a student come in to assist with that research. But it also has implications for our future workforce in terms of engagement with research, capacity to undertake research and recruitment. And I'm also pretty sure that I spend a lot of time with people who have research-related PTSD from something insanely irrelevant they had to do as a student. So I would urge us all to learn from our own past experiences. So preparation also feeds into that idea of being strategic. We are probably better placed than we ever have been for training, support, and services. The flip side of that for clinicians is that it can feel overwhelming. So I would advise to people to think about perhaps it's about keeping your finger on the pulse and reducing the overwhelm by encouraging resources to drop into your inbox. So I've added a slide at the end of this presentation which can be shared with just some of my own go-to resources. It's a very paltry offering, I'm afraid. But emails and alerts about events and opportunities and resources can often be less daunting in the first instance than sort of becoming lost in the wider ether. And as I alluded to earlier, our healthcare workforce shows a strong preference for learning by doing. So this is about seeking appropriate opportunities to get involved, and luckily those opportunities can be really diverse. So it can be anything from helping to recruit participants or playing a small part in a systematic review up to undertaking your own PhD. And I love this quote from our seasoned researcher that when opportunity meets preparation, good things happen. So if you've got an interest in research and there's nothing happening that you particularly want to fit into in the way of projects at that time, then think about training, local programs, building your skills, preparing yourself to be involved. One of the major resources in regional capacity and capability building is other people. So any research and effort in healthcare is not designed to be a solo venture, particularly as patients are at the heart of what we do. If nothing else, our patients, our community are involved. So no matter how much as introverts we want to remain in that cocoon, I'm afraid multi-person support is a must. One of the truisms of building your own or your services research capability is that finding your tribe will help you succeed. At the most fundamental level, you will never know all you need to know. So if we just think about sort of ethics and governance, that's a key example. And you need others to help you fill in the gaps. But it can also come down to support, keeping your morale up, motivation, finding someone to be accountable to. While your support may be local, and this, as I say, should definitely include your research team's research and governance service that covers your service, but it may also include other health services, particularly if you're in a small service and you're a sole practitioner, and regional support such as accessing Western Alliance's research translation coordinator that covers your area. You can also tap into special interest groups and become involved in communities of practice. And as I mentioned at the start, professional silos can be too restrictive in our regional context, and it's important to think outside of those professional roles. And also be bold, contact your heroes, get in touch with people who you know, who you've maybe even read in the literature. The worst that can happen is that they don't answer your email or they say no, and you've nothing ventured, nothing gained. So it can feel daunting to reach out, but as this quote indicates, I've never yet met a researcher who isn't happy to talk about their work. I also get this feeling that we kind of need to step up and recognize that regional and rural services are not necessarily the research underdog. I'm not denying that there's unique challenges, and Leah's done a great job sort of talking through those challenges that we've had at South West Health. But research can also help us meet some of those challenges. At a basic level, this can be ensuring that we have a supportive research culture that helps us to recruit and retain curious minds in our workforce. So in the words of Bing Crosby, let's accentuate the positive and have a look at our community. So the whole sense of community is different for regional and rural locations. So Leah pointed out some of the elements of that, such as maintaining privacy, etc., but also looking at that in terms of the work community. So each individual is more of a vital cog within the machine, and they've got more potential to make a difference. There are also opportunities to build actual real life relationships and have conversations with people who care about what you're doing. You're not talking to some faceless team dealing with sending you genetic replies. You can actually talk to real people because you're in smaller services. And also your community. Communities can be really supportive, and the Barwon Infant Study is a nice example of this. So they recruited over 1,000 participants, and they have an 85% retention rate at 10 years, and that comes down to commitment and support from the community. There are also newest opportunities to address access and equity, and small and large grant opportunities that are specifically aimed at regional and rural. And it's getting very much to the stage of nothing about us without us. So the Health Services Research Stream 2 one that's at the top there, the chief investigator on that grant and 50% of the senior investigative team have to have a home postcode that sits within a regional rural definition for the modified Monash model. And also just sort of circling back round to that building blocks idea that seeding grants, particularly the ones that are coming through at Barwon, are looking at projects that can then move on to bigger grant opportunities. So just keeping those building blocks in mind. So with that in mind, partnering regional and rural is a sought after commodity. Regional and rural health services are often headhunted to take part in projects developed and resourced by external establishments. These projects can be a really fantastic opportunity for funding, capability building, and for patient care. The caveat is that they need to offer something that is fit for your service, and that staff involvement is both valued and formally recognised in negotiations. We don't just want our staff to be research dog's bodies for a project. We want them to have opportunities to build their skills and capacity, and to have their contributions valued and recognised throughout the project. And that includes the opportunity to be involved in publications because they have a unique perspective to offer. And I think our researcher here has captured that quite nicely by I add value at looking at a project and dissemination of results with a clinical lens. Clinicians need to be involved to ensure projects are relevant to our colleagues' workplace and therefore beneficial to our patients. And I've just added at the end there a link for Speak, which is an example of an excellent partnership between Alfred and South West Healthcare. And I'm just aware of time, so I'll keep going. Setting up for success is also about embracing planning and getting used to talking it through. Whether it's about generating cultural shift or research, or you have a specific research question you want to answer, you need to give it an airing, feel how it's going down, assess responses and respond to those responses. We have dabbled at South West with setting up forums to facilitate this. So we had sort of informal research lunches. I feel they began to be perceived as more of a burden, and they weren't that well attended. So we're focusing more on generating a culture where conversations are valued and people feel safe just to knock about and develop ideas. And thinking about the fact that within an idea, you need to consider all the people, processes, resources, other projects, data, timelines that might be involved. If you start to bring all those things in, you're really getting involved in sort of governance 101. So all the things that would feed into a site-specific assessment. So having those initial conversations at the start of a project is really crucial to building that notion of governance processes and getting people on board. And I think just as element of other projects here, communication can be local, but it also needs to be regional. So as a region, I think it's really important that we don't waste resources reinventing the wheel. So we need to know what's going on elsewhere, and that's assisted by regional events and local events like the research day that Leah mentioned, and making sure that those resources are then up on the internet somewhere so somebody from another service can look and see what's going on. So I actually really like this definition from the United Nations about what capacity building is. And I think it's important that we accept that we need to be doing this stuff to survive and adapt in a fast changing world. And as part of that, I would really have a call to arms, encourage everybody to recognize engagement across that whole spectrum of research related activity. And if anybody needs a bit of a positive boost, there is a link there to Bing Crosby singing Accentuate the Positive. And on that note, I would like to say thank you and ask if there's any questions.
Thank you, Denise. Oh my goodness. I'd like to invite Leah to join us in the webinar. And we'll have a look at questions. Please, just a reminder to everyone watching, please pop your questions into the Q&A box at the bottom of the screen. Now, look, you too, if anybody watching this isn't convinced that they should move to a regional area right now, I don't think they've been listening, because what a richness you've both presented. And thank you very much. It's been so insightful. I will go away from my point of view as the host of that research website. I'm going to go away and think quite a lot about the regional collaboration and also the overwhelming resources that are out there and how we can actually streamline that a bit more to make it more user-friendly to people. We have got a question here. It's addressed to Leah, but I'm happy to hear from both of you. A question asking about what's the single biggest obstacle or challenge to integrating research or clinical trials within your health service? You have mentioned resources, but I wonder if you would like to talk a bit more about that. Perhaps if we start with Leah.
Yeah, that is a good question. Resourcing is always ever present. I think we're all kind of aware of that, not just within research, but across the health service. But it does make a huge impact when we can get it. The other thing I think I didn't really talk about too much, but has been really a challenge and an opportunity, being diplomatic, is the getting our executive and our board on board with instigating these changes, but also when we action to them saying we need to implement this, or we need to change this, or we need to fund this for research to work, or to be even accessible. That's been something that we've had to really work hard at, and part of that is because our executive, our board don't come from a research background. So their KPIs, the way they measure it, their understanding of what to undertake to achieve research was quite different to the actual landscape. So the National Clinical Trials work for the accreditation helped a bit with that, but also it is just an ongoing process. And part of that has been explaining that our KPIs are different, but also, I mean, one of the key things that is coming up more and more is that we need our clinicians and our staff, any staff who want to do research, to have time release to do it. Otherwise, they're doing it in their own time. And this isn't something that as a regional site comes very easily, because there is, they may be the only person in their specialty at our site, and the organisation wants them to spend as much of that time as possible doing clinical work. And so there's just that conversation that's constantly happening about why this would be important enough to take away from that, or whether the need to change PD position descriptions. This is something that's ongoing at South West Healthcare at the moment, but it's also we have to build the evidence to indicate why that's. So I'd say that's probably one of our bigger challenges at the moment.
That's a very familiar challenge. I know when we did some research into what regional clinicians were looking for in terms of research training, the engagement with management and the willingness and capacity of the service to release staff to actually do research in work time was a major issue.
Yeah. It is hard when there's only, 2 oncologists in the whole organization. I'm empathetic, but I'm also like, we need it to happen.
Yeah. And that sort of brings me into thinking about the differences between metro and regional services. And something that you talked about, Denise, was being willing to collaborate, but also wanting that collaboration to be fit for service, and to not to be a almost a token gesture towards regional communities. What are some of the differences that you think metropolitan researchers perhaps don't understand about doing research in the regions?
I think it's perhaps an understanding of those slight difference in pressures of our access to patients and how we're going to recruit, so they can think that they've got a really simple recruitment plan, but we can look at that and go, actually, we're not going to be able to hit the targets that you need following that plan. So I think it's for those metro services to be aware of those differences in nuances and be prepared to talk them through so that we can come to a workable agreement. Can't do it, it just how we can do it, how we can do it best. And I think also, I mean, a key thing is just getting that recognition for staff who are participating in other projects, that it's negotiated and written in from the start that they're on there as associate investigators, that they're learning something from this. And it's, I don't know, as occasionally you get things through and you're talking and you're thinking, oh, they just want somebody to do this work. They just want a dog's body to do it. And that's not what we want to offer. And also it's, a program that is maybe something that is really going to work in a metro region maybe just isn't suitable at all for a regional region. So it's about reading carefully what comes through and cherry picking what's going to work for your service. So I think it's, not just reading the top line, but reading through the whole thing and making sure that it's right for you is quite important.
Yes, yeah.
Could I just come back round to some of the questions that Leah was just answering there as well?
Yes, please do.
I was just thinking from a clinician perspective, that biggest barrier is always time and that clinical demands. And so one of the things we've been trying to build, certainly at Barwon, is trying to get clinicians to start to advocate more effectively for their own time. And some of that comes down to the fact that, we need to try and get research written into position descriptions, etc. But we've also produced a document, sort of a checklist for embedding research into practice that clinicians can use when they go into PDRs and give them some direction for how they can start to negotiate those things. And also managers can use to try and build that research culture in their department. So again, those documents are quite Barwon-centric, but if anybody would like a copy or to see those, I'm happy to share.
Thank you. Yes. And certainly when the post-webinar survey goes out, there will be an opportunity there for people to ask for any resources, and we're happy to put them in touch with you or to share them on your behalf. Now, one final question before we run out of time. We're all aware that there's new health networks coming into being soon. with changes in the health services in Victoria. Do you think that the establishment of these health networks will be an opportunity for investment in regional research?
I would like them to be. I think, yes, there's a lot of potential there for them to be like that. I've certainly been asking those questions, especially in terms of resourcing. So if from either the state or the federal, if we're going to get additional resourcing for these networks, so whether that's a regional liaison or somebody who can spend time at some of the smaller sites to help connect them. I think at the moment it all seems quite vague to me, like it's been established, but we're not entirely sure what the parameters are or if we get to create those parameters ourselves. So in terms of South West Healthcare and the research team, we're looking very much at relationship building for the first few months, like reaching out to the other organizations in our network and just making sure that we all know who each other are, where we're at, because we're all at different levels. I mean, South West Healthcare is emerging researcher culture, but some of the more remote and smaller organizations, we aren't even necessarily hugely aware what their capacity is or if this is even a priority for them at the moment. But just establishing those relationships, I think, is going to be key. But I'm certainly going to be buzzwording the networks everywhere in my applications and both internally and externally, because I think that's possibly the way to do it.
Would you have a comment on that, Denise?
No, I think
Right.
I can just echo what Leah's saying there. It's early days and we kind of just have to dive in there and make the most of what opportunities we can.
Yes, yeah. Well, look, there are a couple of other questions there, but I'm going to refer them on to you after the webinar because we have actually come to the end of our time. I just want to say thank you very much to the audience for attending, and there are a lot of thank yous coming into the Q&A there. Wonderful presentation, Leah and Denise. It's very, very exciting to see the excellent work that is happening in the South West of Victoria. And as I say, if anyone doesn't want to move, I don't know why, because what a great environment you are creating there. So congratulations, and we look forward to hearing how it all goes in the future. So thank you both very much.
Thank you very much for asking us.
Thank you. I
Thank
appreciate the
you.
opportunity.